That is regarding, I think, breast cyst 1 centimeter size was given. And next best step was asked, and mostly the image was like this, which was a simple cyst, and it was 1 centimeter was given. And I think if the question has been taken in particular with Sabiston in mind, which they have given that if it is a uh, simple cyst without any internal perturbations and as 1 centimeter size is given, I think observation without biopsy or aspiration should be the answer. I think as per the question which may have been taken from Sabiston. So moving on to next, that is regarding the familial versus hereditary breast cancer, which of the following is false. So just let me know if the options mentioned are correct and what would be the fourth option. And if the question is also fine. This question has been taken from Bailey, this paragraph, this portion of hereditary and familial breast cancer, which has given that familial breast cancer is more common than hereditary breast cancer. Okay. Hereditary breast cancers are more aggressive, and obviously, hereditary breast cancer is associated genetic mutations as well. So, amongst the options, I think that if hereditary breast cancer not associated with any gene mutation or hereditary breast cancer associated with no known genes, that would be the answer, because hereditary breast cancer is associated with mutations such as BRCA, BRCA1, BRCA2, and Lee-Fraumeni syndrome, Cowden syndrome. So according to the options, the best answer would be that hereditary breast cancer associated with no known genes or not associated with any identifiable genetic mutations. Next, indications of thoracotomy in blunt thoracic injury. I think this is a very straightforward question. Both Bailey and Sapiston has told that the answer would be more than 1500 ml of initial output. I think this question has no discrepancies in the options and question stem. So moving on to next, that is regarding pancreatic head mass, multiple cyst in pancreas, renal cyst, hemangioma of spine, broad ligament cyst. I think this is also very straightforward that there are multiple renal cysts and associated tumors of the round ligament. Okay, so this is very straightforward that this is von Hippel-Lindau syndrome that is associated with pancreatic cyst, renal cyst, epididymal cyst, round ligament cyst. Okay, and associated there is pheochromocytoma and hemangiomas of the cerebellum and the retina. Okay, so I think this is a very straightforward question. Moving on to next, again, a very straightforward question. Most characteristic finding in US for chronic pancreatitis. So if you see, I think are the options correct? Has again been taken from Sabiston portion of GIT and pancreas chapter. So there is no doubt about this, but are the options correct in this? I think please kindly reply as soon as possible so that we can move on. So the answer is NPD calculi. Okay, hyperechoic foci is one of the minor criteria. Major criteria is a NPD calculi, and according to the Rosemont criteria, they have mentioned this question on US, and the answer would be NPD calculi, or the main pancreatic duct calculi. Moving on to next, that is granulomatous thyroiditis or decoherence thyroiditis with raised ESR, symptoms of pain and fever. Was this the question or any other additional feature given in the question stem? So see, if pain is not given and symptomatic treatment, corticosteroids and NSAIDs, or symptomatic treatment of pain with or without NSAIDs and corticosteroids, two different options. The best answer would be symptomatic treatment of pain. If at all they would have mentioned about severe pain, then corticosteroids would have been the answer. And Bailey also has specifically mentioned that if the patient is presenting with severe pain, then we give prednisolone. Yeah. So in this, I think there is some confusion regarding the recall. But if you go by both Sabiston and Bailey, I think this question has been taken from, if only pain was there, and if you go by Sabiston, I think from where which they may have taken, or even for that matter, Schwartz, symptomatic relief of pain is the first treatment. Steroids is only given when there is severe case of pain or severe pain. So pain associated can be treated by NSAIDs. So depending on the option, if symptomatic treatment of pain, corticosteroids, NSAIDs are different options, then symptomatic treatment of pain would be the answer. So the first line would be symptomatic treatment of pain. You can give on NSAIDs. And lastly, there is patient is having severe pain, then the answer would be steroids. Okay. Steroids is given for severe pain. Yeah. Moving on to next, that is regarding a patient with inflammatory breast carcinoma with pure orange appearance involving 2/3 of the breast with ipsilateral fixed axillary lymph node. Best step in management. Now, this is again a very straightforward question. I think the question stem is proper. That is inflammatory breast cancer with pure orange involving 2/3 with ipsilateral fixed axillary lymph node. Is the question stem fine? So I think this is again a very straightforward. You first go for NSAT followed by MRM. That is the treatment according to Schwartz as well. So I think there is no confusion in this. Treatment of inflammatory breast cancer is neoadjuvant chemotherapy followed by surgery. Next, that is regarding identification of false statement about medullary thyroid cancer. Are the options given correct? I think there were two questions on medullary thyroid cancer. One was about the lymph node dissection, other was about in general about the medullary thyroid cancer. Is this question with options given correct? So depending, even if it question stem, it was identification, identification of the false statement is asked. And if you see that the central neck node dissection is indicated for patients with T3, T4 tumors. So if the given options are correct, C would be false. That is, it is required in PTC in T3, T4 according to the ATA guidelines. So if the options given are correct, then C would be the answer. Yeah, so I think MTC was different. This is about DTC, but just let me know about the false statement if the question stem and the options. Three options are correct, and let me know what was the fourth option. So I think amongst the given options, the best answer is C, that is central neck node dissection not required in PTC is false statement. So it is actually required. Yeah. So according to this, C is the best answer according to the Sabiston, according to the ATI guidelines given for MTC, PTC. And if we see for Schwartz in that, they have also given that prophylactic neck node dissection is done if the primary size is more than 1.5 centimeters. So that is true. PND is done if calcitonin is more than 200. So B is also true. So according to this options given from your recall, C is the false statement, and that is the answer. Moving on to next, that is thyroid nodule of 1.9 by 1.7 centimeter. Which of the following is false? So I think these options are correct. Yeah, MTC with 1.5 centimeter requires, that is correct option. So the false is CND for T3, T4 is not indicated, was given. That's a false statement. That would be the answer for this question. Moving on to this, that is thyroid nodule less than 2 centimeter, which is false. So if the given options are correct, let me know faster so we can move on to the next. This question is framed from Sabiston portion of the nodule and the USG stratification. So are the options given fine? Was this one of the option? Okay. So if the A option was given, that is the correct answer. Thyroidectomy is not done for spongiform, or that is very low suspicion, and observation should be done for this nodules. So A is the correct answer in this. Moving on to next, that is regarding a paraspinal tumor in child showing mural nodules, hydrocephalus on MRI. Most likely diagnosis. So mural nodules are not there in hydrocephalus, not there in hematoma, not there in meningioma. So I think it is a very straightforward elimination question. Was the image fine? Was the image similar to this, or was the image different? Okay. Yeah, so the answer is posterior fossa complex pilocytic astrocytoma. So I have searched the articles wherein they mentioned that on imaging, this cerebellar pilocytic astrocytomas will have mural nodules, well circumscribed lesions, and they will show calcifications also in 10% of the cases. And also less frequently, they have some cystic component. Okay, so this is the best answer, that is posterior fossa complex pilocytic astrocytoma. So moving on to next, that is a child presenting with progressive dyspnea and history of previous hospital visit of similar complaints. What is the most likely diagnosis? Is the question stem and the options given correct in this? So if cyanosis was not given, then usually the hypoxic spells will not be the answer because they have cyanosis. Yeah. Foreign-born respiratory tract will be having sudden history. Aspiration will not present with previous hospital visits. So according to this, the best answer is acyanotic heart disease, because they'll be having features of heart failure and congestion, which the patient is having. That is dyspnea with history of previous hospital visits. So according to this, the best answer is acyanotic congenital heart disease for this question. Okay. Moving on to next, that is regarding adrenal insufficiency suspicion with, okay, seizures was mentioned. So where patient is also having seizures. Yeah. So if seizures and dyspnea, but I feel that according to the question and according by elimination, I feel acyanotic heart disease is the best answer for this question. Moving on to next, that is adrenal insufficiency with borderline serum and salivary cortisol level. What is the best step in management? Is the question stem and options given correct? Yeah, so if the, this is a very straightforward question again. So if there is a suspected adrenal insufficiency, you go for ACTH stimulation test. And after that, you measure the serum ACTH. So A is the best answer. Again, this is question from Savistron. So as I told that except for neuro and certain plastic questions, majority of the questions are from Bailey, Savistron and Schwartz. So moving on to next, that is regarding a patient with hypertension, not control on 3 drugs, abdominal bruit hurt, both systole and diastole, BP more than 120, she is anuric, which is the following is true. What are the, is the question stem and options given correct? Yeah, so if you see the question stem, this is very much diagnostic of renal artery stenosis. This is straightforward question which they have picked up from the Schwartz, which they have mentioned that the patient with renovascular hypertension presents with systolic and diastolic upper abdominal bruit, diastolic hypertension of more than 115, rapid onset of hypertension, sudden worsening, hypertension that is difficult to control with 3 or more antihypertensives, and there is renal insufficiency and development of hypertension during childhood. See, in the hypoxic spell question, if the cyanosis was mentioned, that then the answer would be that. Just a second. See, if the cyanosis was there in the question of hypoxic spells, then that would be the answer. But if not, then acyanotic heart disease would be the answer best. But I think again, there is a recall bias against this. So you can let me know what was the question. And this in renal artery stenosis question, I think the B option was not there. A is incorrect, obviously. DSA is golden standard. And atherosclerosis is a common reason. Okay. So that is also incorrect. So either C, that is DSA is golden standard, but I think that usually go for renal duplex ultrasound and not DSA, but you guys are unsure about B, but the question is from renal artery stenosis, and that is again, they have picked up question from Schwartz. So I think if you guys can come up with the proper recall, then we can get an accurate answer for this. Moving on to next, that is which of the following is true regarding the small cell lung carcinoma. Please let me know if the options are given correct. An hypoxic spells question. I think there was mention about increases with feed, and you guys are telling that there was mention of cyanosis. So if the cyanosis is given, that straightforward point towards hypoxic spells. If cyanosis is not given, then it is a acyanotic heart disease. In this, I think there was something about diastolic blood pressure, not diagnostic. So if this is there, then DSA would be the answer, but you guys can let me know the accurate recall for this. We can then decide. Yeah, about small lung cell carcinoma. Yeah, so what was the options? I think this has been taken from Bailey then, if you are telling that was about small cell versus non-small cell. But are the options given correct? So usually if the options given are correct, then small cell surgery is not curative was one option. Yeah, that is A option. So basically surgery is curative and they are very much responsive to chemotherapy. So that would be the correct answer. If the options given by you guys is meds was common, metastases are common. Okay. So amongst the given options, if the options given are fine, then small cell carcinoma is responsive to chemotherapy is the correct option. Okay. I think this question has been taken from Bailey comparison between small cell and non-small cell lung carcinoma. So I think B option is correct. Then regarding the statement about phylloid tumor, again, a very straightforward question, that is, it is characterized as proliferation of stromal tissue with variable ductal elements. Straightforward question picked up from Sabiston. Other options are composed of cystic and stromal, cystic and ductal elements. So I think they have taken the line from Sabiston straightforward. So answer given is characterized by proliferation of stromal tissue with variable ductal elements. Then about the patient with history of prolonged seizures, CT brain reveals multiple cystic lesions. What is the most likely diagnosis? Is the image similar to what was asked? Mortality of a 25-year-old male with history of prolonged seizures. And I think the gross specimen was given with multiple cysts. Yeah, so the answer is neurocysticercosis because that is a common CNS or parasitic infection causing multiple cystic lesions and prolonged seizures. Okay. So I think neurocysticercosis is the parasitic lesion, which is the common cause of prolonged seizures or multiple seizures. And if the specimen was showing multiple cysts, then that is the best answer. Okay. Then moving on to next, that is, which of the following is true about medullary thyroid cancer? I think this question is about medullary thyroid cancer. That is, they have mentioned about it as TSH receptor. It is radioactive iodine avid. It is associated with MEN2 syndrome. Are these options and questions stem fine? I think this last lot of questions has a lot of recall issues and discrepancies because they are incomplete recalls and not all of you are able to recall complete options. But if the options given and the question stem is fine, then MTC is associated with MEN2 syndrome is the correct answer if true was asked, because it does not have TSH receptor. It is not responsive to iodine therapy. So best answer is MTC is associated with MEN2 syndrome. What was the fourth option, if anybody can help? Okay. So moving on to next, this is again taken from Bailey. I think there is a lot of questions from this portion. So next is, which of the following are indications of total thyroidectomy except? So I think these options are also fine. That is previous history of radiation therapy, negative molecular profile on thyro-VSEC3, tumor size of more than 4 and tumor involving both lobes. Are the options correct and the question stem correct? Yeah, so according to this, negative molecular profile and thyro-VSEC3 is the correct answer. So there is not been mention about this, but if you go and the articles, if you see, according to the Thyrosec V3, it is classified into negative, currently negative or positive. And if it is negative, they are usually benign. Majority of them are benign. And that is not an indication of total thyroidectomy. So that is the correct answer. Previous history of radiation therapy, you go for total thyroidectomy, size more than 4 or involving a bilateral disease. Obviously, you go for total thyroidectomy. Last, that is regarding a traumatic wound, initially cleaned, debrided, wound margins were approximated. Wound will heal by which type of intention? So this is a straightforward question, that is tertiary intention. So that is debridement. The wound is clean, the wound edges are surgically approximated. That is healing by tertiary intention. That is straightforward question from Bailey. So the answer is C. So I think that is it about all the questions which I had received from you all in the recall. So through all the 7 sessions, including this, if you guys have felt that any question has been missed out, you can just send me and I'll cover it and I'll upload that as well. So see so the spells, so basically dyspnea, if there is no mention about the cyanosis, then it is usually acyanotic heart disease rather than cyanotic. Okay. And if the patient is having cyanosis, then it should be hypoxic spells. So it all depends on your recall. What did the question mention? If cyanosis is there, it is a straightforward hypoxic spells. If not, then it is a acyanotic heart disease. Yeah, so the lethargy, drowsy, childbirth question is again a controversy, so I'm not sure, but I have given the best possible answer from my end, but I hope it is correct for all of you according to what you have marked, but really ensure there is some discrepancies in some of the questions very poorly framed. Phylloid surgery, wide local excision with 2 centimeter margin if given, then that would be answered. If not, then it should be simple mastectomy because the Bailey has only mentioned mastectomy. So I am unsure that what was the option. So if wide local was given, then simple mastectomy will be the best answer. Phyloid questions, I think there is no definite criteria given in any three books about phyloid. So I think that the best answer would be simple mastectomy. Phyloid question, I think Thompson question, again, it depends on all. I have tried to yeah, simple mastectomy would be the answer. Neurogenic thoracic outlet syndrome. If the option was given about CT angio with ruling out aneurysm, that would be the answer because that is clearly mentioned in Sabiston. Thompson question, if buried dermal flap was given, that would be the answer. If subdermal flap was given in the option, then the piloidal sinus would be the answer, but it all depends on your recall because many of you are telling that it was subdermal, many of you are giving it was dermal, so I'm unsure. Yeah. So I think that's it. I've tried to cover everything. Yeah, buried dermal flap, buried dermal and buried subdermal. I think that's the confusion between in all of you. No, CT angio, if it is given with ruling out aneurysm, then that would be the answer. It is, see, I think irritable cry, it was given, I think many of you have told me, so it is all taken from pediatric GCS table of Bailey. So the best answer is given. So I think this is, yeah, irritable cry, I think it is again straightforward from pediatric GCS portion of Bailey. So I think whatever questions are left, if you guys can send me, then I'll cover them. Neurogenic thoracic outlet syndrome has been taken from Sabiston. You can see in the thoracic surgery chapter. So I think that is a very straightforward question again from Sabiston. So as I told you all guys that the majority of the questions are from Bailey, Sabiston and Shorts. You'll find the references in the books. There are only 10 to 20 questions I feel of neuro, euro and certain other questions which are out of the book, but majority are from the three books. I think the level of paper is not very tough compared to last year. Definitely some questions are totally tough like neurosurgery questions, but I feel it is almost similar to that of last year. So I'm not expecting the cutoff to fall. It can be same as last year. That is what I feel, but I may be wrong. Cutoff for 1000 rank, really, I'm unsure about the merit list of last year, but I'll have to check. You guys can also check the merit list of last year and you can check the marks at what 1000 rank was and it will help you. I think the last year merit list was available. To be honest, I think because of the straightforward questions from the books, I feel it was not a very tough. Yeah, it was tough paper, but I think it was almost similar to what they had last year. Yeah, clinical scenarios have increased and that I expected, and I had prepared you guys in the decathlon by giving as many as clinical scenarios as possible. But again, it all depends on examiner from where they take the questions, and our answer would be according to the reference of the book. Yeah, definitely. The time-based questions increase the pressure, and when you face certain tough questions like what you had, it definitely adds on the pressure. Yes. Multiple sessile polyps, again, I told you that, see, many like Blumgard and all will tell you that sessile polyp is a risk factor, but they have taken the question from Sabiston. So that is the answer. You cannot change that. So don't try to justify what you have answered from different references. The answer in the paper would be from one reference where the examiner has framed, and that will not change. Cutoff will almost be same. As I told again, it will be almost similar to last year. So I think I would have discussed all of them, but I think I tried to get all of the questions, whatever was possible on my end. But still, if any questions has been missed out, then just send me across. I'll try to cover it. So thank you all for joining, and don't worry about what you have scored through the recalls. This is just to help you all because many of you requested for this. But see, there will be discrepancy of plus minus 5 to 7 questions, I feel, because there were certain controversial questions. But other than that, don't worry about whether you're getting less or more. Eventually, the reference what they have mentioned in the NB will be the deciding factor. So just be prepared for the worst and also for the best. Yeah, see, there will be certain discrepancy, but as I'm telling you, any more queries, you can reach out on WhatsApp, or you can always write in the group, or you can reach out to me directly. I'll be happy to address them. And any questions, if left out, please let me know so that I can be, I'll be covering it as soon as possible. I think, but I have tried to cover majority of the questions in this recall sessions, and I'll be uploading this session as well. So thank you all. And all the best to all of you. Don't worry about whatever you're scoring. Be prepared for the best and worst, but just relax for now and prepare for INISS if you are giving it. Otherwise, just relax till the results because you can't change anything now. Thank you all.